and do that. But right now, let's go ahead and start with Senator Rowden, Senate Bill 830. Please come forward and tell us all about you.
Thank you, Senator. Mr. Chairman, members of the committee, Senator Rowden here today from Boone County, formerly of Cooper County, Boone County. Senate Bill 830 is a very simple bill that deals with non-addictive opioids. Over 1,500 Missourians died from opioid overdose in 2022. I think all of us have seen direct impacts from this epidemic. We've done a lot to help with this, but there's still more that we can do. According to the AMA, an estimated 19% of people who take prescription pain medications develop an addiction. This bill simply directs DHSS to develop an educational pamphlet on non-opioid alternatives for pain treatment and to publish it online. The pamphlet will be distributed every 2 years to public health agencies and provider associations to raise awareness. The bill has no fiscal note. Florida has enacted a similar awareness statute, so we have an example of what this pamphlet could look like. No mandates on providers or patients, but we do think the bill, if implemented into law, will increase awareness on the available alternatives to opioids so that patients can make an informed choice. I'm happy to answer any questions.
Thank you, Senator. Any questions for the Senator? Seeing none. Do you have anybody to testify in favor of your legislation?
Not sure. Maybe.
Please come forward, state your name, fill out the form, all that stuff.
Mr. Chairman, David Winton here on behalf of Borough Behavioral. I want to go on record and support legislation. Thank the Senator for bringing it forward in the committee's consideration.
Any questions? Seeing none, thank you. Anybody else in favor?
Good morning. Katie Gamble here on behalf of the Missouri Center for Public Health Excellence and Haleon, and we want to go on record in support. I don't think there's much more to add.
Thank you. Any questions? Seeing none, thank you very much. Anybody else in favor? Anybody opposed? Anybody for informational purposes only? Seeing none, that concludes the hearing on Senate Bill 830.
Senator Bernskoetter, whenever you're ready.
Thank you, Mr. Chairman, members of the committee. I have Senate Bill 844. This legislation ensures that any amounts paid by the patient, including from financial assistance program, will count toward their deductible. Some insurers have created policies that patient financial assistance will not count toward their deductible, and this legislation only applies to drugs that don't have generic equivalents. It doesn't do anything to step therapy. Last year, this bill was voted out of the committee 5-0 and 117 to 138 in the House. And in summary, the legislation simply says it doesn't matter where your copay comes from when calculating your deductible. And I'd be happy to answer any questions.
Thank you, Senator. Any questions from the committee? None appearing. Any witnesses in support of Senator Bernskoetter's legislation? Thank you for your testimony. Any questions for the witness? Appreciate you being here. Thank you. Other witnesses in support of Senate Bill 844?
Mr. Chair and committee members, thank you for the opportunity to testify today in support of Senate Bill 844. My name is Gabby Flores, and I'm a patient here with Gateway Hemophilia Association, and I also sit on the National Bleeding Disorders Foundation Board of Directors. At 14, I was diagnosed with a qualitative platelet dysfunction, meaning that my blood does not clot like the average person. To put this into perspective, prior to my diagnosis, I had a 6-month-long period. As a 7th grade girl, I bled every single day for half of the year. My parents and I fought for 3 years to get my diagnosis, and it took another 6 for me to find a combination of medications that would control my bleeding. This 10 milliliter vial contains 3 days worth of medication for me. It costs $860. This is the price of just one of 3 medications I require to manage my one chronic condition. Without access to this medicine, my quality of life drastically deteriorates. I sit here today as a representative of not only the bleeding disorders community, but all of those with chronic conditions. According to the CDC, 6 in 10 Americans currently live with a chronic condition, and 4 in 10 live with 2 or more. Copay accumulator programs directly impede a patient's ability to receive essential and often life-saving medical treatment by placing an unnecessary financial burden on the patient. Studies have shown that 80% of all Missouri health insurance plans contain these programs. The insurance companies will tell you that copay assistance programs drive patients to higher cost drugs, but 99.6% of patients have no generic alternative. In many cases, we are lucky to have one medication available to us. We are not asking you to lower the prices of our drugs. We are asking you to prohibit insurance companies from charging us twice for them. By allowing these programs to exist, you will be putting more money into the pockets of insurance companies and taking life-saving medication out of the hands of patients. 60% of the population is living with a chronic condition and is at risk of falling victim to these predatory programs. By that logic, 4 of you should be able to relate to our struggle. Understand that accumulator programs like chronic conditions do not discriminate and can fall onto any of us at any time unless you pass legislation like Senate Bill 844. This committee has the power to do something that very few can, which is to make living with a chronic condition substantially easier. Thank you for your time.
Thank you for your testimony. Any questions from the committee? Thank you for being here. Other witnesses in support of Senate Bill 844?
Good morning. Good morning, Chairman and members of the General Laws Committee. I'm Bridget Tyree. I'm the Executive Director of Gateway Hemophilia Association. So hemophilia is a chronic disorder. Their blood doesn't clot properly. The cost is about $400,000 a year. So someone like my son, he gets his medication on a monthly basis. So he'll get it in January. He'll use his copay assistance card. It's applied towards his max out-of-pocket deductible. What insurance companies are doing with the accumulator adjuster, they're saying when a patient has, so say like in January, he'll use it, he'll meet it for the year because the cost of his medicine's about $400,000. So he'll meet his out of pocket, so he goes to order it in February. Insurance companies are saying, no, you haven't met your deductible yet. You haven't met your max out of pocket. And then the patient will say, no, I met that in January when I ordered my medication. They're not applying that to the patient's out of pocket deductible. So this is not about insurance companies. It's not about manufacturers, big pharma. It's about allowing patient assistance. I'm here to bring the patient side. I passed out a letter to you. There's 31 organizations behind this legislation. What you could do by voting this out of committee is help hundreds of thousands of Missourians have access to their life savings medication. It's been passed in 19 states, plus Puerto Rico, plus DC. Missouri, we could be next. We could be number 21 to pass this out of legislation. So I'm here to answer any questions that you have today.
Thank you for your testimony. Any questions from the committee? None appearing. Thanks for being here. Other witnesses in support of Senate Bill 844?
Good morning. Thank you for your time this morning to allow me to share a little bit of my family's experience. My name is Jackie Glasscock. I've been married to my husband Nick for 15 years and we have 2 children. Shortly after birth, our oldest child, Nathan, was diagnosed with a rare disorder called Prader-Willi syndrome. Prader-Willi syndrome, or PWS, is a genetic disorder. It's caused by dysfunction of a portion of the brain called the hypothalamus. The hypothalamus is a small endocrine organ at the base of the brain that plays crucial roles in many bodily functions, including regulating hunger and satiety, body temperature, pain, sleep, wake balance, fluid balance, and emotions. Currently, growth hormone therapy is the only proven drug intervention for PWS. And Nate has been taking daily injections of growth hormone since he was 6 weeks old. Now at 9 years old, he would proudly tell you that he does his nightly injection himself. Nate's growth hormone dose is partly based on his size. So as he grows, his needed dose of nightly growth hormone increases, and so does the cost of his medication. Currently, Nate's supply of growth hormone costs thousands of dollars per month. In our case, as is the case for many children and adults with rare diseases, there's not a cheaper generic alternative available. The company that makes the drug provides a yearly copay assistance. For several years, this aided our family immensely, helping to meet the deductible of our insurance and easing the burden of the high cost of Nate's medication. Then, without warning, a few years ago, our insurance company implemented a copay accumulator. It was only then, after doing some research, that we learned that our insurance company wasn't required to inform us of this change. We learned about it when the bills started rolling in. The copay accumulator program allows our insurance company to accept copay assistance from the drug manufacturer, but they don't allow this assistance to count towards our insurance deductible or out-of-pocket maximum. In short, this allows the insurance company to double dip, collecting the deductible twice, once from the copay assistance program and once from us. Not applying to the copay assistance to our deductible renders it useless in helping to manage the cost of our son's much needed and very expensive medication. In general, raising a child with a disability is expensive. Nate's care involves doctor's visits to more specialists than I can count on my fingers, multiple weekly therapy visits, adaptive equipment that allows him to interact with his peers, and travel to participate in a clinical trial out of state with the hope that by doing so, we may alleviate some of the more debilitating symptoms of his disorder. Copay accumulators add to the financial strain, and while we have been fortunate to be able to continue Nate's treatment, other families are faced with heartbreaking choices simply because they cannot afford to continue with their child's medication. Because of early and continued growth hormone therapy, and in addition to access to therapy and quality care, Nate is doing well and is generally a happy third grader who loves puzzles, Legos, and tormenting his little sister. It is my hope that all children will have access to quality care and treatments they need to manage their condition and in many cases simply survive. By eliminating copay accumulators, we can help to ensure more families are able to afford their child's medication. Therefore, I urge you, the Missouri Senate, to end this unfair and unnecessary burden on patients and their families and ban copay accumulators. Insurance companies will still get paid, patients' assistance programs will pay the same amount, but the bill would prevent families from facing the unthinkable burden of being unable to afford their child's medication. Thank you.
Thank you for your testimony. Any questions from the committee? Does not appear so. Thank you for being here. Other witnesses in support of Senate Bill 844?
Emily Kalmer, American Cancer Society Cancer Action Network. Thank you for the opportunity to explain our support for Senate Bill 844. And thank you to Senator Bernskoetter and our other Senate sponsors for filing this legislation. Similar to the experiences you heard today from patients like Joan, many cancer patients and individuals living with chronic conditions have difficulty affording the cost of their medication. For cancer patients, particularly newer drugs, many of their treatments don't have generic equivalents. So to deal with these high prescription drug costs, many of them do get assistance from manufacturers or from charities to help them afford their prescription drugs. Unfortunately, in the last number of years, probably since around 2017, we've seen that insurance companies are not treating the copays when they're paid for with these assistance the same toward the patient's deductible and out-of-pocket costs. So the patients have explained how that's impacting their ability to afford their medication, and we also know that that impacts the treatment, because when patients skip pills, that impacts the efficacy of their treatment. So I just want to point out, since we're going to hear from the opposition later, a few of the things we typically hear in opposition and why those aren't the case. So often we hear complaints about coverage mandates and how that drives up the cost of premiums. We're not requiring coverage for any drugs here. They have already made the decision. The doctor prescribed the drug. The insurance company has already put this drug on their formulary. They still have access to all of their step therapy and prior authorization that they're allowed to do currently. So they already made the decision to cover this drug. We're just saying now, when you're covering this drug, allow the patient's assistance to count toward their copays and out-of-pocket costs. The other thing, like I said, to the premium discussion, as you've heard, 19 states, including 5 of Missouri's surrounding states, Arkansas, Illinois, Kentucky, Oklahoma, and Tennessee, have passed this legislation, and we have not seen an impact there. So I know that's something they'll mention, but just wanted to put that forward. I'm trying to think if there's anything else. Sometimes we talk about the fact, I think there's an idea that, like I said, that they're steering people towards particular drugs. As I mentioned, cancer patients often don't have options. This is the drug their doctor prescribed. This is what they need for their treatment. So the idea that this assistance is steering them to a particular drug is not really true when there's not generic equivalents, there's not other options for them. So just wanted to mention those in anticipation of some things our insurance brethren may say, and I'm happy to answer any questions.
Thank you for your testimony. Any questions from the committee? Senator Serpoi.
Can you walk me through this? I have a child that has very expensive medication, and the pharmaceutical companies are sending me a coupon. How does this work? 'Cause I guess my question is, how do the insurers know that somebody's helping me pay for this drug?
Sure, and I know some of the folks from the Pharmacy Association can probably talk to you about how this is actually processed. But for instance, like in the situation of a cancer patient, they may have a prescription, and they will talk to their doctor. I've heard one of our patients talk about how she told her doctor, I don't know how I'm going to be able to afford this. They often will mention some charities have pharmaceutical assistance programs. Some pharmaceutical companies do, so they'll help provide them with a number. They can call them and get that. So I think I was talking with Joan about this before. Her medication comes through the mail. She has the pharmaceutical assistance. It is counted towards the cost of the copay that she would be billed for, and then it's just on the back end when she's got her deductible. It's not being counted toward the deductible.
Okay.
So, but like I said, I would probably say if you want to know about how the pharmacy processes it, I am gonna let someone else
I'll wait till
touch
have
on
somebody else answer that question. But it just occurs to me if a grandmother helps them pay for this drug, do they track that and say that's not allowed, or?
Well, and like I said, sometimes these are charitable programs from some charities do provide prescription drug assistance as well. So the way the language in this legislation is written, it covers those programs and the pharmaceutical programs. We're talking about when you get assistance for your drug.
Somebody else answer it. Okay, thank you.
Any other questions from the committee? Does not appear so. Thanks for the testimony.
Thank you.
Next witness in support.
So, Mr. Chairman,
Yes, Mr. Chairman.
Can we establish a quorum? Can I do that from here?
I think you can do that from here
Okay.
or there.
You think so? Is that right, Scott? Okay. Let's establish a quorum. Kenny, please call the roll. Here. We have a quorum. Our committee is officially established. And like Mr. Chairman, I know you're running this committee, but Mrs. Calmer mentioned kind of having a back and forth, what somebody might say. So if we could do back and forth with the witnesses, but that's up to you. You're in charge.
Yeah, we're not doing that. Next witness in support.
My name is Anna Meyer. I'm representing the National Multiple Sclerosis Society in support of Senate Bill 844. Multiple sclerosis, or MS, is an unpredictable disease of the central nervous system, and currently there's no cure, but there are treatments, and those treatments are critical to minimizing disability for people who are living with MS. However, those treatments, the average cost is $103,000 per year, and few of those treatments have generic alternatives. Due to that cost, 70% of people living with MS rely on copay assistance to access these treatments that prevent permanent disability in their bodies. Copay accumulator programs extend the deductible period that patients face each year, and this puts their medications out of reach with this average cost, but it also puts other medical treatments such as MRIs, other doctor's visits, physical therapy, occupational therapy, any other rehab therapies they're doing until they meet that deductible. So as long as these copay assistance payments are not counting towards their deductible, they're unable to access any of those things until their deductible is met. Applying copay assistance towards their deductible or out-of-pocket max will help them access all of their healthcare needs. So we are supportive of any solutions that make it easier for people living with MS or any other illness to access the life-changing medications that they need. Thank you.
Thank you for your testimony. Any questions from the committee? Does not appear so. Appreciate you being here. Next witness in support of Senate Bill 844.
Good morning, Mr. Chairman, members of the committee. Scott Penman, representing the ALS Society. We want to testify in support. ALS is a neurological disease, ultimately fatal. We have approximately 600 folks in the state at any given time living with ALS. Many of those folks pay an incredible amount of money out of pocket, not just for prescriptions, but all the other assistive devices and things it takes to try and keep your family member as healthy as possible during their final years. And we appreciate the senator introduce this bill and strongly support it.
Thank you for your testimony. Any questions for the witness? Does not appear so. Next witness in support.
Mr. Chairman, members of the committee, Jorgen Schlemeyer on behalf of the Missouri Pharmacy Association. So if the chairman gives me just a touch of leniency here. The chairman also has another bill, and that bill attempts to ensure that the rebates that are given by manufacturers get to the plan sponsor, the employer who's paying the premium. Senator Brown, because the PBMs have figured out, the insurance companies have figured out how to take those rebates and intercept them from getting to the plan sponsor and putting them in their own pocket. Senator Brown has a bill where there's a discount program from the manufacturer, and that discount is supposed to go to the healthcare facilities that care for folks that are uninsured or underinsured. And the PBMs have figured out how to slice off the rebate or the discount and stick that in their own pocket instead of it actually getting to its intended purpose. And now the PBMs and the insurance companies have figured out how to get to the patient. The manufacturers meant a discount to get to the patient, yet they have figured out how to take that discount too and stick it in their pocket. Now, this bill is solely intended to ensure that when the federal government actually, on a couple of these bills, went to the manufacturers and said, hey, here's what we need you to do to kind of help out on drug prices, I'm pretty certain they didn't say, and make sure that the insurance company pad their pockets and it doesn't get to the intended recipient. All the patients and the patient advocates that you've heard before, those folks are the intended recipients, and we do not need the insurance companies and the PBMs intercepting their money, or, put a better way, I think somebody said, double collecting on a copay. If someone else, grandmother, sends the patient with $25 to the pharmacy, then that too should count toward their copay, just as if any other third party that's not the insurance company sends the patient to the pharmacy with money. It should satisfy the patient's participation. It does not cost the insurance company more money, and it should not count against, or it should count against the patient's deductible. Thank you, Mr. Chairman.
Thank you. Any questions for the witness?
Thank you.
Does not appear so. Thank you. Any other witnesses in support of Senate Bill 844?
Good morning, Mr. Chair, members of the committee. Thank you for the opportunity to testify. My name is Jay Hahn on behalf of Missouri Association of Osteopathic Physicians and Surgeons. This is a patient-centric bill, and we support it.
Thank you for your testimony. Any questions for the witness? Does not appear. Thank you. Any other witnesses in support of Senate Bill 844?
Mr. Chairman, members of the committee, Randy Scher representing the Missouri Association of Family Physicians in support. I couldn't add anything to what our excellent witnesses have already covered.
Thank you. Any questions for Randy? Does not appear so. Thanks for being here. Any other witnesses in support of Senate Bill 844?
Mr. Chairman, David Winton here on behalf of the National Association of Social Workers, Missouri Chapter and Borough Behavioral. I want to go on record in support of this legislation.
Thank you. Any questions for the witness? None appearing. Any other witnesses in support of Senate Bill 844? None appearing. Any witnesses that would like to testify in opposition to Senate Bill 844?
Mr. Chairman, Shannon Cooper today representing America's Health Insurance Plans, and it's apparent I drew the short straw and have the opportunity to go first. I will say that none of us are immune to the ravages of bad health, and this April will mark the 9th year that I saw my father wither away and die from lymphoma. So I definitely have sympathy out here for everybody else. And while I disagree with my good friend Emily that programs like this do raise costs, I would draw your attention to the fiscal note put forward by the Department of Transportation, which predicts a $2.2 million increase to their health plan if this would pass. And I'm just going to be frank. We have a contract. If you have an individual plan or if you have an employer-based plan, and that contract is you are going to pay your deductible, not somebody else, not the manufacturer of a product. And I think that brings us to the global question of, if I have to provide discounts for my product so somebody can afford it, maybe as public policymakers we need to be looking at why is that happening. If things, and whether that's a pharmaceutical or whether that's an insurance plan or whether that's a procedure or a prosthetic device, if the individuals making that and producing it have to pay a large portion of that to induce individuals to use it, maybe the simple solution would be to lower that price for everybody. And I'll leave that with you all today. This issue's been around for years, and as I said, some states have adopted it. We continue to hold the position that this does raise the cost of health plans, and I think as we do that and you see more and more people fall off the rolls, that does not benefit us as a state. That'll be happy to answer any questions.
Questions from the committee? Senator Serpoint.
Thank you. You comment about the pharmaceuticals and lowering their prices overall, but how about third-party charities? You're doing the same thing to them, right? If they help one of their members or one of their folks that are on their rolls,
I think
you're
it would
also
depend,
collecting that too.
I think it would depend if that is a cash assistance program to that individual or if it is a coupon accumulator program. So some charities make a cash contribution to an individual to help them. Others do it different ways, and those folks that were supporting the bill could probably explain that better than me.
Okay.
If I can ask, we heard testimony earlier that I think 5 states around Missouri have implemented legislation vastly similar to this, and the testimony that I recall said that haven't seen adverse effects for the insurance companies in those states. So what do you make of that?
I would say that look at the state consolidated plan. Those rates continue to increase. Look at the individual market. Our rates continue to increase. Can I say that this piece of legislation will raise those premiums X percent? No, but it adds on. And I think programs like this, when they shield consumers and policymakers from actually knowing the true cost of that service or that product, it just piles on, and then suddenly we get to, quite frankly, where we are today, and we're gonna hit a point at some time where employers quit providing health insurance, and we see that in the small market right now. It gets more and more difficult for small employers out here to continue to pay these premiums and insure people. And I know you're in a horrible position. I mean, it's pretty clear where I'm at with my clients. You're the ones that have to make that vote, and it's very difficult to look at the folks that were up here supporting this and say, hey, I understand your plight, but I got to be against it because I'm concerned about everybody else out there that's not suffering from the disease you had, because I'm worried that they won't be able to afford any insurance either. So, like most things over here, that this is in your hands. I can only tell you practically what happens when we put these policies in place, and they will drive up costs.
But it's hard to substantiate by how much.
Right.
You can't give me a.
I would be a liar.
You can't give me a 2%. This is
Right.
going to add 2% onto everyone's premiums.
I would be a liar if I said, Senator, this is going to raise plans next year 3.8%. I can't tell you that. I can't tell you our plans will go up next year.
They go up every year.
They go up every year. And what we like to say is
We go up every year and we cover less every year.
We try to
It's
keep
fantastic.
those.
It's
we
quite a
try to-
business model the insurance guys have.
We try to keep those increases as small as possible. And remember, 85 cents of every premium dollar you pay, we have to use on your health care. We're the only people that are mandated that way.
Any other questions from the committee? Hearing none.
Thank you, Mr. Chairman.
Thank you. Any other witnesses in opposition to Senate Bill 844?
Mr. Chair, members of the committee, Michael Henderson for the Missouri Insurance Coalition, opposing this bill for many of the same reasons that Mr. Cooper pointed out. Since Mr. Schlemeyer mentioned the federal government, I want to point out that some of these manufacturer coupon assistance programs are illegal under some federal programs, including Medicaid. We oppose this bill for the simple fact that it does nothing to actually lower the cost of the drug on the back end. And address the manufacturers keeping these drug prices artificially high through the use of their assistance programs. So for that reason, we oppose this. Thank you.
Any questions for the witness? Hearing none.
Thank you.
Thanks for your testimony. Other witnesses in opposition to Senate Bill 844?
Thank you very much. My name is Zach Dunn. I'm here on behalf of the Missouri and Kansas Laborers District Council. We represent more than 12,000 construction craft laborers and about 35,000 belly buttons across the state. The Laborers District Council would like to testify today in opposition of Senate Bill 844. After conferring with our fund managers and attorneys, it's our understanding that Senate Bill 844 would actually negatively impact our healthcare fund. If you read lines 21 through 27, it discusses that when calculating an enrollee's overall contribution to any out-of-pocket maximum or cost-sharing requirement under a health benefit plan, a health carrier pharmacy benefits manager shall include any amounts paid by the enrollee or paid on behalf of the enrollee for any medication where a generic substitute for said medication is not available. So it is our understanding that when we are applying those manufacturer discounts to the member's copay, you're rewarding the member for something that they didn't actually pay out of pocket, and that's adversely impacting our fund where they are experiencing more costs. We're bringing on more costs to the fund, which inevitably hurts our fund, hurts our ability to cover our members, and it will ultimately increase cost. And for that reason, we want to ask that you vote against Senate Bill 844. Thank you. Any questions?
Any questions from the committee?
Thank you.
Other witnesses in opposition to Senate Bill 844?
Morning, Senators, members of the committee. My name is Sean Stevenson. I'm Director of State Affairs, Pharmaceutical Care Management Association, PCMA for short. Appreciate the opportunity to share my concerns on Senate Bill 844. PCMA is a national trade association representing pharmacy benefit managers. PBMs administer prescription drug plans and operate mail order and specialty pharmacies for more than 275 million Americans with health coverage through large employers, health insurers, labor unions, federal and state-sponsored health programs. Copay accumulator programs are health plan programs designed to thwart drug manufacturers' efforts to force employers, unions, public programs to pay for expensive, sometimes unnecessary brand medications through the use of a copay coupon. Accumulators typically disallow the counting of a manufacturer's coupon toward the patient's out-of-pocket maximum and deductible because the patient hasn't actually incurred the cost. This ensured that the patient is incentivized to use the plan formulary and that the plan functions as it was designed. Drug manufacturers encourage patients to disregard formularies and lower cost alternatives by offering coupons to help patients cover the higher costs. This ultimately steers patients from cheaper alternatives and towards more expensive brand name drugs, completely undermining the formulary offered by a plan sponsor. And here are some of the facts as it relates to coupons. One, the price for drugs with manufacturing coupons increase faster compared to non-coupon drugs. If Medicare's ban on coupons were not enforced, costs of the program would increase $48 billion over the next 10 years. For every $1 million in manufacturing coupons for brand drugs, manufacturers reap more than $20 million in profits. And the question that you had, Senator, what was the cost increase? I'm going to cite a 2020 study by the Commonwealth of Massachusetts Healthcare Policy Commission estimates that coupons increase premiums to the Group Insurance Commission program, which is their state employee program, by $18 for a single premium and $52 for a family premium on an annual basis, which means about $44 million a year. By definition, coupon targets only those who already have insurance. Copay coupons are not means tested or designed to help the poor or uninsured. Considered illegal kickbacks in the federal health care programs, as stated by the previous witness, copay coupons are still permitted in the commercial market. Coupons only reduce short-term costs. Coupons are temporary. The individual patient likely pays more when the coupon goes away instead of being started on the formulary drug from the start. If it is the manufacturer who benefits by forcing the plan to pay the more expensive drug. PCMA does not impose true means-tested patient assistance programs that help individuals afford their prescription drugs. There's an important difference between mean-tested patient assistance programs and copay coupons, which are targeted at individuals with health insurance. I'd also like to speak to the author's carve-out that says that this would not be applicable where, quote, medication where a generic substitute for a said medication is not available. While that would likely lessen the utilization of a coupon overall, coupons would still be allowed for a costly name brand drug when a less costly competitive drug or therapeutic alternative is available, continuing to drive up the total drugs spent. As an example, we're all hearing about weight loss drugs. There are two primary ones out there. One is Ozempic. It's a semaglutide. It costs approximately $936. An injection of Wegovy, which is also a semaglutide, costs $1,049. Under this bill, if it were to be allowed, a coupon could be allowed for the Wegovy if there is even though there's a less costly alternative available. With that, I will conclude my testimony. Thank you for your time.
Thank you for your testimony. Any questions, Senator Black?
Yeah, I do. I've listened. Overall, the discussion is about money and who's going to make it and who's going to be paying for it. Would that be right? Is that what the discussion is about?
As it relates to copay coupons, yeah, that's
what the discussion is. Okay. If the bill passes, where will those costs go?
Yeah, sure. So, traditionally in this country, the employer who provides a benefit to their employees.
Okay, so anybody consuming insurance will be the one that pay the additional costs.
Correct.
Anybody that's a consumer in that field. If the bill doesn't pass, which is where we're at now,
yep,
it's still a cost. Who's paying it now? That increased cost.
So, yeah, well, if there is you as an employee whose employer provides health benefits, you have a certain plan. And all plans are different, right? Like, I assume you have a state health employee plan. That's going to be very different than someone who has a small business that may employ 10 people. All plans are different at the end of the day. So employers put together a benefit program for their employees that they can, with their best effort, right? All plans are different. At the end of the day, plans are designed for job creators and businesses to provide benefits to their employee at the end of the day. And sometimes that means increased costs for the patient to pay at the counter if there's like a high deductible plan, for example. So it all depends on the plan design.
Okay. If this bill passes and becomes law, this may be too simple, but most people tell you in here I got to be pretty simple with me. If the bill passes, an insurance consumer will be the one paying the additional cost, probably.
Yeah, a
And
plan
if the bill
sponsor- a
doesn't
plan sponsor,
pass, a consumer of medications will be the person paying the additional cost.
Sure.
So ultimately, a person like me right now that's not, I have a friend that I think his chemo drug was $21,000 a month. He's passed away now, so he's not paying it at this point. Ultimately, where I'm at, I'm one of the people that's going to pay no matter what, right? Because I'm not getting the benefit of this, and I'm going to be probably insurance for a while longer before I make the decision. So people like me or the consumer no matter which way this is going to go.
Right, and I appreciate those comments, Senator. And I guess it's worth noting too that this bill mandates the use of coupons. In the commercial market, only 60 or 39% of all plan sponsors use an accumulator. So 61% of the commercial market has said we allow coupons. Like, they have made the decision. The employers who provide the benefit have the ability to pay for a health care plan that allows accumulators. That's up to each individual consumer at the end of the day that provides benefits. So 39% of the population has said, look, I need to, help keep costs down, and I need that accumulator in place, because if I don't, my costs are going to skyrocket to the point where I might not be able to provide benefits to my employees at the end of the day. So this bill simply mandates something that the commercial market can already do. And I guess that is definitely worth mentioning.
Well, I don't want you or anybody else to think that I'm on one side of this or the other at this point. It just seems to me like for some of us in the middle, it really doesn't matter the outcome. I'm paying one way or another. Okay, thank you.
Thank you.
Any other questions from the committee? None appearing.
Thank you.
Any other witnesses in opposition to Senate Bill 844?
Mr. Chairman, members of the committee, I'm Chris Long, a registered lobbyist with the St. Louis Area Business Health Coalition. We're a coalition of 40 major St. Louis area employers that provide health benefits to over 500,000 Missourians. I think everybody here today can agree that that the price of prescription drugs and the price of healthcare in general is too high. I mean, it's our largest cost of doing business. The simple approach would be for the drug manufacturers to simply lower their price. Then we wouldn't be here today. We're concerned about mandates, directives, increased administrative costs on insurers, and PBMs that ultimately will be passed on to us. And when we receive those cost increases, we have no choice but to consider a whole lot of bad alternatives, such as increasing the employee portion of benefits, or to discontinue providing benefits altogether, none of which are a good alternative. And because of that, we oppose this bill and would ask the committee to do the same.
Senator Serpel.
Thank you. So at what line, what's the cost of a drug that you'd say we'd quit confiscating the copays?
I'm sorry.
What is the dollar amount for a drug, the cost, where you'd say we will no longer confiscate the copays that are coming in from third parties and let them be allowed?
I tell you what, I do not represent an insurer. I represent employers. I think that's a better question for folks on the insurance side.
Okay. Well, because you said that you would quit this practice if drugs didn't cost so much, so I assumed you had a number in your head about the cost of the drugs.
No, I think what I was referring to is that as our costs increase, we're forced to make some difficult decisions in terms of, do we absorb the cost? Do we pass the cost on to our employees?
I just don't see you stopping
Do we pass
this.
the cost on, in terms of increased prices for goods and services?
I just don't see you lowered prices even if these prices come down. It's a practice that's embedded. I think it would stay there. But anyway, thank you.
We unfortunately, we don't set prices. Employers don't set prices. We pay the bill, but we don't set prices.
Any other questions? None appearing. Thank you for your testimony. Any other witnesses in opposition to Senate Bill 844? None appearing. Any witnesses? Mr. Chairman, do you do informational purposes? Do you do informational purposes? I will just open it up. Any witnesses here that would like to testify for informational purposes on Senate Bill 844? Does not appear so. Any closing comments, Mr. Chairman? Thank you, Mr. Chairman.